Do not leave this podcast without going to the link in the show notes or description and clicking on the link to learn our centralization process. We will show you what you're missing in your sciatica recovery. And in this link, there will be a very important opportunity at the end for you to learn exactly what this plan could look like for you. Hello and welcome to episode 96 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with the RehabFix online low back program. And today's topic is how to diagnose SI joint dysfunction. I wanted to make this podcast because I hear from people every week, we hear as a team, they're talking about their SI joints all the time. Hey, I think I have SI joint dysfunction because I feel pain around my SI joint, or because my physical therapist told me it's my SI joint, or because my orthopedist told me it's my SI joint and he wants me to do an SI joint injection or an SI joint belt or whatever. There's tons of confusion about the SI joint when it is actual SI joint pain, which is actually quite rare, and when it's not. So this podcast is going to help you self-diagnose whether you have SI joint dysfunction or not, so you can either check that box or not, so you know other things to pursue in your rehab or in your plan. And it's going to equip you with a lot of information as well, so that when you do meet with different providers, you can actually know what the heck's going on. As always, if you have not joined my private Facebook group yet, you need to. It is called RehabFix Low Back Program. In this group, I'm actually going to post a video of me going through these tests and describing what you should be assessing for even more in depth than today. I have free sciatica guides in there. I have other guides in there. You will be tagged in our sciatica guide that we use with clients around the world simply by joining. So if you are serious about resolving your back pain or sciatica issues, then you need to join this group, because it is an act of intention. It shows that you're committed, that you want to be in a community, and there is thousands of dollars worth of information in this group for free. So join this Facebook group, RehabFix Low Back Program. Now, the reference I'm using for today's topic, those of you who are listening and are not watching, you will be sure to visit the show notes of this podcast so you can look at the article that I'm referencing when this is over, because I'm going to be describing some tests and I'm going to be showing pictures on the video format of this on YouTube. I'll be showing pictures. Obviously, those of you who are listening cannot see this. So when you're done listening to this podcast, go to the show notes, click on the article, and visit the article so you can actually see how all of this is working and how it's operating, okay? So everyone is told it is their SI joint, but it rarely is. But how do you know? This is the testing sequence that you can go through to determine if you have it or not. So we can realize together it's most likely a disc issue. that's most likely what it is. So here is the reference sheet, okay? There are 5 key tests that you can go through with a friend, with a partner, whatever, to determine if you have SI joint pain. I'm going to say the names of these tests. I'm going to visually describe them, and I'm going to add a picture on the screen. Once again, if you are listening, you need to visit the show notes to find the article. So here are the 5 tests. These were developed by Mark Laslett, and these have been a mainstay in orthopedic testing for quite some time. So in order, okay, the first test is the distraction test. This is essentially laying on your back, flat on your back, the front of your hips, your hip bones in the front. You will have a partner put their hands on either side of your hips. So they're standing above you. Their hands are on the front of your hips, those front hip bones, and they're pushing and pulling them apart. They're pushing them apart outwardly. Okay? That is test number 1. If this is positive, you will feel pain directly over your SI joint, directly over it. Test number 2, the compression test. Whatever side your SI joint is irritated, let's say it's the right side, you're going to lay down on your left with the right side up. Your partner or friend is going to come over and push on the outside of your pelvis straight down towards the floor. Straight down towards the floor. If you feel pain is reproduced on that same SI joint right in that spot, then it is positive. The third test, okay? The third test is our thigh thrust test. This test, once again, you're laying on your back. One leg is going to be brought up to 90 degrees. So just imagine you bring your thigh up to 90 degrees. And then your partner is going to push your leg or your hip straight into the ground or straight into the table, whatever surface you are on. Now, some individuals will also put their hand on the sacrum of the individual to support that as they push the thigh down to provide a shearing force at the SI joint. Okay, I have seen people who are on a softer surface still feel a positive test with this, but that is an additional way you can perform it. Now, the next test, okay, this is our Gainslin test. These are getting harder to describe. So those of you who are listening, you might be slowly tuning out a little bit. It is important for you to visit the link so you can look at these tests, or so you can just watch this video and look at these tests. So the last one is Gainslin. This one, once again, you are laying on your back. You are going to bring one of your legs to your chest. You're going to hold one of your legs, okay? The leg that is not the side that's involved. So let's say your right side, once again, your right SI joint is the one that's involved. You're going to lay on the table or the edge of the bed or whatever option you have, right? You're going to bring your left knee to your chest. You're going to scoot to the edge of the bed so your right knee is hanging off. Your right part of your body or your right thigh is hanging off. Your partner, individual, is going to come over. He's going to hold that knee, the left knee that you're holding on your chest. He's going to hold it next to your chest. He's going to put his hand on top of your right thigh. And he's going to push these apart. He's going to push your knee up. He's going to put your leg down. You're going to see if you feel pain directly in that right SI joint. Okay. The next test is going to be our sacral thrust. This is our last one. Okay. Our sacral thrust. This is the only one where you are prone or on your stomach. And with this one, the individual, your partner, I should say, is going to come up and they're basically just going to put their palm of their hand directly on your sacrum and they're going to push straight down on the base of your sacrum, to be specific. They're going to push the base of your sacrum straight down. So you're on your stomach. They put their hand on your sacrum. They push straight down. If that reproduces pain directly on that SI joint, that is a problem, then it might be involved. So these are 5 tests, okay, to help you diagnose SI joint dysfunction. What they typically find is that if you have 3 or more positives, then it's a high likelihood that your pain is coming from your SI joint. Okay, this is the best clinical criteria around so far from an orthopedist standpoint to diagnose this. So it's very important that if you are struggling with this or you think you are, grab your partner, grab a friend, go through this together and see what the outcome is. If only one of them or 2 of them slightly bother that one spot in your SI, then it's probably not the problem, right? If it's barely feeling it, it's probably not. Okay. You want to feel significant amount of discomfort in that SI. You want to feel 3 or more positive tests. It should be somewhat obvious. So if you go through this and there's not a lot of positives and you're like, wait, but I've been told that I have SI joint pain for 2 years now. If it's not that, what is it? It's probably a disc. So many of our clients who were told that they have SI joint issues, this is just pain being referred across the SI joint. A lot of our clients with disc issues, they'll get pain through the hips, around the hips, to the front of the hips, down into the glute, down the back of the leg. It can go through the SI joint too. This is just a region of their spine that can feel a lot of pain. Some people will feel pain referred onto their tailbone. It doesn't mean they have a tailbone problem, right? It doesn't mean their coccyx is all out of whack, right? It's just referral from the lower back, from the discs. This is super common referral. So we get a lot of messages. Hey guys, I need help. I have SI joint problems. Do you work with that? Almost always we say, yeah, maybe. We need to go through an assessment first though. 99 times out of 100, we'll take them through our testing and we'll go, yep, this is an SI joint. This is actually this or that. And they'll go, what? But I've been told forever that it was this. Well, you didn't have a proper assessment. That's just the way that it is. So many people are told different things from different providers. Very rarely is it their first diagnosis. That's just kind of the nature of being in mainstream healthcare. You're going to hear a lot of different things. And the SI joint is one that's very easy to blame. Hey doc, I have pain down here in my low back. Oh, you're kind of pointing to your SI joint. It's probably a SI joint pain. Okay. No, it's not that simple. Okay. Pain is complicated. Also, it's important to keep in mind that even more testing beyond this is helpful for the big picture. When someone's in pain, when someone has low back pain, you could push almost anywhere around their low back and they're going to say, oh, that hurts, right? Because it's pain. Pain's an experience. If your body is sensitive, if your nervous system is sensitive, a lot of things are going to light it up. So even at certain moments, orthopedic testing cannot be so valid. The point of these tests is that it highlights the specific localized point just in that SI and not much else does. That's what's going to make it more definitive, okay? So this is the testing that you should go through with your friend, with your partner, with whoever to try to determine if you truly have that or not, okay? What are the best methods then to resolve this? Well, typically what we do with our clients with actual SI joint problems, which are few and far between, it's a combination of addressing the glutes, or the hips rather, I should say, hip mobility, hip stability with the external rotators, also hip stability with the internal rotators and adductors. We work through core function movements, and we go through low back, typically end range loading, or we go through low back mobility and stability work too. Addressing the low back, the core, and the hips in multiple directions is what will resolve these types of SI joint issues. This is what we prescribe for our clients with this, but once again, most of the time, it's not the SI joint. Most of the time, it's referral from the lower back, from the disc, or from a nerve. When we determine that, suss that out, then we can actually know what we're working with. And once we actually know what we're working with, then we can make a bulletproof, specific plan designed for you to go down the appropriate path so that you have the right plan and the right guidance to go along with it so you can finally start getting results. You don't have to keep running around in circles, feeling like you're chasing your tail, getting some results with this and they go away. Some results with this go away. The temporary results train is an exhausting one. And I don't want you to have to ride that train any longer than necessary. I would like you to get results now and to get this thing over with. And that is what we are here for, to help you find that right plan. This is what we do with people all around the world. We love what we do, and we love achieving success stories with people who thought that it might have not been possible for them. They just needed the right assessment, and they just needed the right plan. So we'd be honored to help you. If you would like our help, then absolutely visit the link in the description. Join our private Facebook group, RehabFix Low Back Program, to gain more information on how we could possibly help. Submit an application on our website. If you are watching on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review to help this podcast grow and reach more people. That is a free, zero-cost way to help support me and to also help other people actually find a solution, because you deserve to be pain-free. You deserve to get the right care. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.